Unshelling Medicine podcast. Healthcare in the language we understand.
Hello, great day everybody. Welcome to another episode of Unshelling Medicine podcast. I have the pleasure of hosting Dr. Devin Patel. Dr. Devin is the founder of Javasa Longevity Institute in San Diego, California. So today's conversation is going to be based on everything we talk about: holistic integrative approach to healthcare, where we are, and modern discovery in healthcare that can give us more of a not only long, but vitality, a well-being that we so meaningfully deserve wherever you may be in the world. So join me in welcoming Dr. Devin Patel.
Thank you, everybody, and looking forward to an amazing conversation with Idongesit. And just a simple clarification and disclaimer that I'm not a medical doctor by training. I just want to make sure, but I worked in the field of stem cell research, gene therapy, and cancer research for the last 25 years and rubbed shoulders with the best of the best brains around the world and in our facility and in our organization. So I learned a lot along the way. And I'm here to share those learning and how we can live much healthier, much better, and meaningful life and meaningful health that we have. Thank you.
Thank you so much for that clarification. The conversation that we're going to have is one that is meaningful and is applicable to everybody or almost everybody where they feel necessary. So longevity, why?
I am blessed with the amazing health. Okay. I happen to be by nature health conscious. And at the same time, I've seen people around me as I was growing up, my adulthood and stuff, people were getting older, faster, having aches and pains, chronic diseases in early 30s, early 40s, and it just doesn't make sense. Losing hair, losing eyesight, having all kind of pains, back pain, all things. And this is something just didn't make sense. And I took my health for granted. I thought, oh, that's normal. And it's supposed to be normal. But when I looked around, I was an exception. And that didn't make sense. Why am I exception? It should be available to everybody. If I am like that, and I live very healthy, but at the same time, very complex lifestyle where I travel so much around the globe for 6 months to 9 months for the last 25 plus years, constantly changing my time zones. So your sleep cycle is totally screwed, right? You don't know when you're going to eat, where you're going to sleep, when you're going to wake up. All that is complicated. So I should have a lot of problems, but I didn't. And all that was going on. And I said, there has to be a better way. There has to be a better way for not me, but for everybody. And that's kind of led me into the stem cell research 25 years ago.
Okay. So you just mentioned traveling 6 to 9 months at a time. And, for an average person listening is like, well, that's kind of like a vacation. You're just going from one spot to the other. Can you delve in a little bit to how devastating that can be to the human body? Because we have people who have careers that demand managing global logistics, global offices, who may not think twice about the detriment of having to go from one time zone to the other or one climate to the other. Just talk a little bit about how devastating that can be to the human body.
Travel, I do this travel in a very different state of mind. I'm doing this because I'm taking and making this most advanced science and modalities and protocols for anti-aging and treating chronic disease using stem cell, making available to the masses around the globe and make it affordable and make it accessible. That is my mission. As you said earlier, it's my divinely ordained project. It's a divinely ordained guidance that is allowing me to do this. Nobody can do this for 25 years. Okay, you will go crazy. You will get tired. You will get burnout. You will have all kind of problems. It didn't happen to me only because it is a purpose-driven life. It is something that I'm not saying I wake up every morning excited to do it or anything like that, but there is a very strong foundation of what you are doing. It has a very strong meaning. You're reaching out to thousands and millions of people. I go around the world, work with the world governments, help them develop their stem cell policies, stem cell transplant programs, stem cell research programs. So that is not only take toll on your body when you travel, and I travel 16-hour one flight, okay, straight, sometimes more than 16 hours straight flight, and that changing your sleeping cycle, because it's almost 12-hour difference. If I'm in America and I go to Asia, that's a 12-hour difference. Means when I go to sleep in America and when I reach Asia, I'm supposed to wake up, not go to sleep. Right. So and on top of it, you have meetings, you are going to the places, different cultures, different people, different stress, different kind of systems, governments, bureaucracy, business people. It is not that simple. And it takes not toll just on your physical body. It takes toll on your mental health. It takes toll on your family health. It takes toll at every level. But when you live life of absolute devotion and absolute gratitude, then you can thrive in that environment. Otherwise, I'm telling you, I've seen people after 5, 10 years, they just basically have a tremendous burnout. You can't be going like that, constantly getting on the planes, changing your sleeping cycle, your food, the different type of food. I'm vegetarian. So usually in a certain part of the world I go, I get just the rice and some soup, not much. So it is not that easy, and it hurts. Your body is breaking down at some point when you're sitting 16 hours. Doesn't matter, it's a business class or this. It hurts, okay?
So if you're traveling, again, be mindful of these changes. So can you please talk about the role of stem cell in longevity? So stem cell is not something that we talk about regularly in everyday healthcare unless there's a need to talk about it. So what is your position in bringing stem cells to the front and its role in longevity, which is your area of focus?
I am healthy because with all that complex lifestyle of travel and time zone changes and everything, because I'm doing my anti-aging stem cell infusions every year for the last 20 plus years. So I haven't aged much in last 20 years. I'm 55, but my biological markers are somebody's in early 40s. So I'm constantly holding or halting my aging, my energy level, all my organs, functionality. It is at somebody in early 40s. And only reason I've been able to do that, one is a very important purpose. And at the same time, I have a tremendous backup system. My battery gets charged when I do my anti-aging stem cell infusions. And I've been doing it for a long time. I'm doing it for my family members, friends. And of course, we have helped thousands of people getting rid of their diseases from root cause, because stem cell is the master cell of the body. And this cell, from one cell, our entire body is created. And this one cell has a blueprint of your entire body. So if this cell can make your entire body, then why can't we use the power of that cell to repair your heart, repair your kidney, repair your lung, repair your brain, repair your eyesight, repair your bones, repair your chronic disease, autoimmune disease, neurological conditions, anything, any kind of metabolic diseases, because cells' job is to repair and regenerate. So anything that degenerates in your body, stem cells' job is to repair and regenerate. And it's a core and quality. And we're just using the power of nature. We're just enhancing it a little bit by adding more cells, because as you grow older, the number of stem cells goes down exponentially. That's why we age. So age is also disease in a way, biological decline. So the goal is to add more cells into your system so they go and start repair any damages. Because as we grow, there are a couple of things happens. As we grow older, it's not like we are going very 1, 2, 3, 4, 5. It is from 1 to 3 to 7 to 12. People, your patients would have said, I feel like I have aged 20 years in last decade. Have you heard that? I'm sure you must have heard that.
Yes.
And what they're saying is not incorrect. They're saying it correctly. As you go older, number of stem cells goes down exponentially. So your aging speed increases. And that's where you actually deteriorate. 20 years worth of deterioration in actual 10 years. So it is true. They are not telling you lie. Actually, they deteriorated 20 years worth of deterioration in just 10 years. As you know, after 60 or 50 people say that. And only way and best way to repair, regenerate, and rejuvenate that biological you is through stem cell. It's the most natural way of doing it, to live disease-free life and age without aging, because we're going to the root cause and getting rid of the disease from the root cause instead of just maintaining the symptoms or managing the symptoms, because stem cell is taking us back to the root, because we're going to the root and a root cause, because that's the beginning of our biological life. So it is the most modern medicine, okay, most advanced medicine, yet it is the most natural medicine, because we're not putting any chemicals in your body. We're not putting any synthetic material in your body. Actually, we're using your own cells, just multiplying it and preparing it and infusing it. So all we are doing is energizing your body, the already inbuilt repair system, and we're just putting into the higher gear.
So you touched on a whole lot, which I'm struggling to find which one to go with first, but I'll arrange my thoughts.
Pick one.
I know. You touched on chronic disease, you touched on acute illnesses, you touched on symptom management, but you also touched on aging and, what you have done with your own self, where at your age, your organs are functioning at a much younger capacity. So I want to start with the aging aspect first. So if somebody just feels like, I'm a little too old, I don't think this would be effective for me. I'm already in my 70s. I'm in my 80s. I would like to feel a little better, but I feel it's too late for me to start, stem cell infusion to improve my disease process or my life, the quality of my life currently. What would you say to a person listening to this conversation?
I'll tell you, I'm going to read one sentence here. Longevity is not about just living longer. It is about living stronger, healthier, and with purpose. And regenerative looks at the body's innate ability to repair and regenerate and rejuvenate. I'll talk with the example. My father is an 85-year-old young man, okay? If you meet with him, you will feel you're talking to somebody or seeing somebody and functioning somebody in their 60s. And he's a practicing lawyer, okay? And he's a spiritualist, so he does his spiritual practices. Yeah. He lives in a home which is 3-story. His office is in his basement. His temple is at the top of the terrace. So he goes up and down 3-story building several times a day. Then he goes to the high court, where the court building is so huge, where he may walk 1, 2, 3 miles, depending on where his cases are. And we keep his body in a perfect shape. And with stem cell, we do anti-aging for him every year. And sometimes we do it this even 6 months period, because sometimes he comes back and say, I have these aches and pains, my shoulders hurt, my knees hurt. And we take care of him. His biological age is early 60s. Chronologically, he's 85, but he's functioning with somebody, and he never complains, going up 3-story 10, 15 times a day. Imagine up and down at 85. So age doesn't matter, because your body is designed to repair itself. This is nothing new, I'm telling you. It is body's inherent quality, and cell's job is to repair and regenerate. It's only the number of stem cell goes down exponentially. That's why we age. So if we add more number of stem cells, that means what we are doing, we're accelerating your repairing process. In your factory, I'm coming with the crew of 10 versus crew of 200 and start repairing your factory. And crew of 10 versus crew of 200, I'm going to finish my job much faster, right? Much better, much easier. So the factory will run back to its original capacity. That's all we are doing. It is simple. It is not complicated.
I love the simplicity of it. But, I am smiling because you said your father is an attorney, and that is a very high stress job. Not play down the doctors, nurses, and everybody else in the world. But that is a very high stress career path, and it takes a toll on the body. And for the fact that he's 85 and still functioning, that is a great marketing person. So you should pay him.
Yeah, it is his blessings that I have been able to do whatever meaningful in my life. It is his blessing. He's a spiritual giant. He's an enlightened being. attorney is just a little activity that he does to be active life. But he's a spiritualist, advanced yogi, and it is his blessings that's allowing me to do all these wonders in life.
So beautiful. Thank you so much. I love that, and blessings to him. So let's talk about chronic diseases and symptom management. So again, this platform is to talk about the beautiful synergy that we can have in the modern healthcare system, specifically the American healthcare system, where there is an embrace of integrative holistic practices along with the curative system that we have, or the symptom management system that we have, involving treatments, modalities, and things of that nature. How important is it that stem cell treatment or stem cell infusion in any symptom management, whether chronic or acute, can be beneficial to healthcare recipients in the United States and globally?
The application of stem cell originally, when we started 25 years ago, nobody was even talking about it. We were doing bone marrow transplant for the last 40 plus years for lymphoma, leukemia, the blood cancers. Okay, very complex. You have to eradicate their immune system, irradiate their immune system, and then restart everything. It's complex. The modern field of stem cell and that we started 25 years ago were the people who originally started here in San Diego, California, a group of scientists. And the premise of that science was not only find cures for diseases, we still do that, okay, in our research side of the business, but how do we live disease-free life? How do we prevent a disease from coming? So stem cell works at both levels. At the early stage, prevention, like me, that I'm not letting any disease or my body to go down because I'm keeping those organs, functions, and its efficiency at its max as possible, which is preventive medicine, which I do every year, the infusion. And it's not some surgery or anything. It's just IV, anybody can do it. Then IV and the preparation of stem cell and everything is very complex. I'm not saying that's easy, but the infusion is a simple thing. Now, let's talk about disease. Now, somebody didn't have access, which I had for the last 25 years, right? That means their disease has progressed to quite chronic or even worse levels. But there also, what can you do? Modern medicine is not going to work. It's not working. You have already tried everything. Again, stem cell is also one of the most possible non-invasive answer to repair and regenerate and rejuvenate your body. Let's take example of diabetes type 2. It's I like to speak with examples, so then it's easier for the audience to understand how the regenerative medicine stem cell science works. So type 2 diabetes is called insulin resistance. Everybody in general understand it's the insulin resistance. And insulin resistance means your pancreas in your bodies is creating insulin, which is picking up the sugar from your blood and delivering it to your cell so that cell can use that sugar to create the energy and run your body. The simple cycle. But in diabetes type 2, it says insulin resistance means your pancreas is creating insulin. Insulin is going and picking up all the sugar from your blood and delivering to your cell. But cells are not receiving that insulin. It's resisting it because all the cell receptors or the doors are covered with the free radicals or garbage or things that blocking those doors. So what happens in that case? Your sugar level goes higher, right? Because sugar is not being utilized. So the message goes to your pancreas like, oh, I need more insulin, more insulin. So your pancreas goes into the hyper mode and creates more insulin. That insulin's trying to pick up all the sugar and deliver, but it doesn't deliver. So your pancreas loses its function eventually after 5 years, 10 years, because it's going in a hyper mode constantly. So what we do with stem cell, if you think about it, we come in and stem cell first start clearing the cell receptors, the doors that are covered with the garbage and the gunk and the free radicals. It start opening those doors. So what happens? The insulin start picking up the sugar. It start delivering it. So your cells have a fuel to create the energy in your mitochondria. And slowly, let's say somebody's HbA1c is 11. Right? Slowly, it is coming down to 9, then 8, in 8, then 7, and then 6. And you're below 6, you come to normal persons or non-diabetic person, and then a second time, what we do is start repairing your factory, which is your insulin producing factory, which is your pancreas, because pancreas is going 2000 miles per hour constantly in a hyper mode. So we come and repair your factory. So then slowly, the balance happens. Then enough normal insulin gets created, all the sugar being picked up normally, and it is being delivered to your cells, and it starts and utilizing the sugar to create the energy. And slowly, it comes down to a normal below 6 HbA1c. You are a normal person. And then what you do is maintain your lifestyle. That's where the holistic medicine, functional medicine comes, where you maintain your lifestyle with the diet, the proper food, proper lifestyle, proper exercise, and you're a normal person. So now what we did, we got rid of your disease from root cause, okay, without poisoning your body with the modern medicine or allopathic medicine, which have a lot of side effects, which affects your heart, your kidney, your vision, and many other things. And we put you back to your normal. So age doesn't matter. Whether you're 70-year-old or 50-year-old, we got rid of your disease. Once we get rid of your disease from your root cause in the most natural way, without putting poisons and without having side effects, now it's up to you how healthy lifestyle you are going to maintain. If you maintain it, everything will be fine. If not, then come back to me again.
So I like the way you put that. So talking about coming back to me again, I think that is one of the frustrations that I've been blessed to be able to support people with chronic diseases, and the fatigue of the back and forth is something that, I've heard a lot of complaints about. So if somebody were to ask you about, okay, if they were diagnosed with diabetes and they're undergoing stem cell, you mentioned for maintenance, you do it yearly, is an annual, ritual for you or intervention for you. So for somebody with a chronic disease, is there a treatment modality or care plan to have this treatment more than once a year, or an annual infusion, in your estimation, should be enough? Because I'm taking it to monitor, like hemoglobin A1C, that is measured every 3 months, right? So in order to see the effectiveness of this stem cell infusion or treatment, is there a treatment team or a care plan or anything that is dedicated to treating somebody who may come to you and present with a diagnosis like diabetes?
So for each disease, the treatment protocol, because this is a personalized and precision medicine at its best. That's the best part about this. It is not one fit all, just everybody take one tablet for diabetes, and it doesn't work that way. So it is a personalized and precision medicine is best. And when people come with the chronic conditions like diabetes type 2, kidney disease, COPD, many autoimmune diseases, Crohn's, vasculitis to psoriasis, we have to look at this first stage of disease, type of disease, and their lifestyle and everything. Based on that, we basically create their protocol. And their protocol, usually it's a 3 infusion within, depending, month to 30 days to 60 days period, okay? Then we see them for next 6 months and how they're responding to that treatment, to maybe even 9 months to 12 months. And based on that, we call them back after 9 months to 12 months and say, hey, please come back. We haven't got to that below 6 yet. So we would examine them, their lifestyle, what kind of food, everything. And then we maybe do another infusion. Once we got rid of your disease from root cause, you don't have to keep coming back. But I tell people, do come back. Why? Because you're constantly aging. That is a biological progression that has to be also addressed. So therefore, I like to put, even after, let's say you got rid of your diabetes type 2, you're living normal life, but you're still aging. And aging is a biological disease. We can put it in that category, not in a negative sense. So therefore, we want people to come back every year and make this as a preventive protocol. So that way, what you're doing is investing into your health so that you live most meaningful life with all the vitality and all the strength and all the good possibilities that you can do with your life. So you need that body. The health is the best wealth. You can have all the money in the world. Steve Jobs had a pancreatic cancer, but that didn't save him. So if you would have done the preventive care, which you would have used like I have been doing, then chances are you live much more healthier and meaningful life, purposeful life.
Yeah. Thank you for that. So let's go into autoimmune disease or disorders. You and I, when we first met, we talked about sickle cell, and sickle cell is something that is very near and dear to to my heart and to me because I am a sickle carrier. Very few people know about stem cell treatment or transplant for the curative. Most people believe once you have a sickle cell, that is it for life, forever and ever and ever. However, there are treatment modalities like stem cell that help people live long, fulfilled, healthier lifestyles. Can you please talk about, your work with sickle cell specifically? I was so excited when you said it. So I want others
Sickle
to benefit.
No, I understand because it's a devastating condition. So let me ask you, in your education, are you guiding also people that even because certain governments that I have traveled and worked with around the globe, they help those population to guide them even for their marriages so that their kids wouldn't be carrying or become a carrier. In your system, you have that kind of a system where you guide the male and female in the family to how to marry and all that, so the next generation may not become a carrier. Is there a
Yes.
such system you deal with?
Yes, in Nigeria specifically, there's a system. In the United States, I don't see that as much. And that is where the awareness comes into play because even within the United States healthcare system, as great as it is, there's still miseducation with sickle cell management. I know providers who work in healthcare that refuse to go to the hospital when they're in crises because of the stigma of being labeled a drug seeker, because people do not understand the devastation that the pain carries. There's a certain shame element attached to, disclosing that you're sickle carrier or you have full-blown sickle cell. And unfortunately, people don't find out until they are going through prenatal screening and finding out that, hey, the baby has full-blown sickle cell because you and your husband are carriers or you and your partner are carriers. But I've been healthy all my life. Just because, you've not been symptomatic doesn't mean that you don't have the genetic disposition. So there's a lot that can be done, especially in the United States, not only to educate providers, but also to educate people commonly affected who, with sickle cell, who are Black and brown folks, sickle cell and thalassemia. Partner selection. I mean, most of us have gone through falling in love with somebody and having to break up because of genotyping and understanding that, there is no way we will have a healthy family together. So I think more of that education is needed. I don't see enough of it. And there are organizations that are, working to battle or educate the community, but they need funding and support to make it a broader campaign so people can be aware of, not only managing themselves, not only treatment, but also avoiding having children diagnosis.
So I would like to say within next, so we are in 2026, by 2030-ish, there should be a standard treatment protocol for sickle cell and thalassemia that people can basically get rid of their disease very easily, because there are several organizations like ours working not using only stem cell for sickle cell, but also gene therapy, where you just basically take, and it's going to be so simple that you're just going to take patient's blood, we do gene therapy in the lab, then we infuse back that properly developed and gene corrected cell back into the body, infuse back, and slowly your factory will start making a proper round red blood cell instead of a sickle shape, because sickle shape, that's why it gets called sickle, because it gets stuck into each other, and that's how you have a blood flow problem, and then the pain and many other things that happens in that system. So there's, I wouldn't call it hope, there's an absolute possibility that sickle cell and thalassemia will be normal conditions that will be addressed very easily. Only thing preventing this is the, as you also mentioned in your, it's the funding.
Yes.
And the financial model around it. Like in America today, for lymphoma leukemia and sickle cell anemia, it may cost $500,000 to almost $750,000 for single bone marrow transplant. Okay, that is outrageous. I can do the same thing for you for $5,000. So why that much? And that's why I told you earlier, I'm one of those most feared CEO in life science in America, because I'm making, and not only talking about it, I'm making it affordable. And the system is such that wants to keep things inaccessible. That's why we said our purpose is very simple: to make this most advanced science available, accessible, and affordable to the masses. And that's what I've been not talking, but I'm living, and I'm doing it. And I've traveled around the world, and we have facilities around the world where we're making that possibility, working with the governments. Because when you work with the governments, then the funding becomes easier, and you have a much faster way of developing these programs for the specific countries, so that people can get benefited from it. But I'm telling you, by 2030-ish, people should have access to this, and it should be very affordable by then. Yeah.
So I think that is one of the barriers to care, is the socioeconomic factor.
Yes.
Because, like you so rightfully stated, stem cell transplant is a very huge price tag. And, with the insurance payers are not willing to approve a treatment that costs that much. So a lot of people live with, the devastating effect of not getting the right treatment. Given your outlook for, 2030 or around there, what would you offer to anybody living with sickle cell thalassemia about, self-management, treatment modalities, seeking out organizations such as, yours to either work with and, look for treatment plans that would help them not only manage their symptoms, but treat diagnosis?
So I would say seek for clinical trials that are underway. Okay. There are several clinical trials underway. So if you seek and participate there, because the biggest problem when we do clinical trials is participation.
Absolutely.
Enrollment of the patients. So there are companies who wanted to do, let's say, sickle cell,
right,
clinical trial for sickle cell, for stem cell, using stem cell or gene therapy. It's the recruitment is a problem, nothing else. So if you are in that kind of condition, please review that clinicaltrial.gov and other sites and look for those trials and participate and then you get to the most advanced treatment for $0.
Yeah. Now, but do you know why the participation is low, especially for the people affected?
Tell me. I'm not sure.
Trust.
And also the information. Not only trust.
Trust
is very important. Trust is very important.
Because of the history, of unethical testing, unethical, trials. So that has been one of the things that I have worked with great organizations to help with that process of, pharmaceuticals, health organizations conducting clinical trial, to be transparent so people can feel comfortable. Yes. Especially the people that need that treatment and need that intervention can feel comfortable that you are not, for lack of a better word,
guinea pigs. That's the term that's being used. Right? Exactly. But I will say something on that. And I'm glad you raised that point. Why? The best part of a cell and gene therapy, they're not chemicals. They're not putting some foreign chemicals or synthetic materials in your body. These are your cells or the donor cells that are being used. Yes, there's always a risk. Okay. And that's why we call it a medical practice.
Right.
We are still practicing it. It's not perfected, right? But the beauty of cell and gene therapy is, especially cellular therapy, we're not using chemicals. We're using your own cells or our donor cells. We're using the biology that is in the nature to get rid of or addressing the symptoms or addressing the root cause or trying to get rid of your disease. So there are much lesser risk than getting into, there is always risk, okay, but much lesser risk. And by the time you're reaching to the clinical trial, we've spent 20 years in the lab, okay? So we have tried everything. And nowadays, the best part of the advantage of cell and gene therapy, you're creating an environment in a petri dish with the cell and seeing it, what's happening real time inside your body. It's before it is going inside your body, we're looking at the petri dish. So a lot of safety concerns are addressed quite earlier. I mean, I'm taking stem cell for 20 years. I have no problem. I'll tell you a story of my mother who had an autoimmune disease, psoriasis. And she had horrible psoriasis, and people in India doctors are sticking steroids to her in her body for 4 years. Imagine 4 years of steroid. What does it do to your body? And we just brought her in, and in 72 hours, her itching and burning was gone, and her condition was not normal psoriasis with cracked skin and blood coming out and all kind of stuff. And I put an ointment on her body with the gloves, and she would scream, all kind of stuff. And we brought her in. She was in a believer. And in 72 hours, in 3 to 4 hours, her burning and itching was gone. Because before that, she was saying somebody's taking a torch and burning me continuously 24 hours. In 2-3 hours, her burning and itching was gone. In 72 hours, 90% of her skin was repaired. And it's an autoimmune condition. So it came back a couple of months later, because your immune system, we have not remodulated properly yet. So we did second and third transplant stem cell treatment for her. And basically, she lived a wonderful life, disease-free life after that. No itching, no burning, normal skin, just like yours and mine. And what a blessing as a son, you can do that for your mother, that you can take away your mother's pain within hours. I mean, what a blessing. I mean, as a son, if God empowers you to do that, think about it.
Goodness, thanks for sharing that. And that's the one thing that as children we want to do for our parents.
Yes.
Take away whatever stress or suffering. And
yes,
you did that in real time. So
that's the biggest achievement of my life.
Good for you. Good for you. You know, you mentioned donor stem cells. Okay. So there's umbilical cord blood banking or storage. So what is your take on that, especially when with treatment of autoimmune disorders as opposed to a person's own stem cell? So
first of all, a couple of things. There's several layers of the answers.
Okay.
First answer, umbilical cord, stem cell derived from umbilical cord or umbilical cord blood. Two things, right? Yes. One is a tissue, the umbilical cord, and the other is umbilical cord blood. Derived stem cells. Okay. So that's absolutely fine. Secondly, your cells versus donor cell, right? Your own cell is called autologous. Donor cell is called allogenic. All we are using for last 20 years is adult stem cell. So adult stem cell has certain, and specifically mesenchymal stem cell, has a inherent quality, and what's important quality is that it's immunoprivileged. What is immunoprivileged means if it's a donor cell and it goes to the host, it doesn't reject, rather it home into the host body. So your cell or the donor cell is not an issue anymore. I'm doing my stem cell treatment for last 20 years. In the early stage, I did my own cell. After that, I haven't used my own cell. In our labs, we have a donor cell properly prepared and stored, and we just pick the vial and we infuse, and I have no problem because they integrate into your system because it's immunoprivileged.
Right.
And that is not an issue anymore. Also, I've been saying it for the last 20 years that, a lot of companies who promote saving the cord blood for your kids, and the tactic is scaring the parent. Like if you don't store and something happens to your kid after 15, 20 years, you will be regretting and all that. Okay. That is bad marketing. Okay. Rather, they should educate them in a proper way. Okay. Instead of using the scare tactics, and young parents and they get emotionally blackmailed and they're like, okay, we'll pay you every month for next 20 years. Rather, you educate them that because what happens, you store this for next 10 years, 15 years, and you need it. It's going to come back. You have to bring that to me, right? Or organizations like us. Then we have to be able to see that was it stored properly? And is there enough cells left? Or can I revive more cells or enough cells? And usually one cord blood cells are not enough to treat adult. So I need a couple more, right? So that means I needed other people's cells too. So it is good for the public storage, public registry for the cells, okay? But your and my mom did not save your and my cord blood, stem cell, or the cord blood, right? So what about us if something happens to us, right? So the science has advances so much that you and I don't need it. Even if we don't have it, fine. We're going to use the donor cell because it's all adult stem cell and there is no problem. So it can come from peripheral blood. It can come from cord blood. It can come from cord tissue, it can come from your fat, it can come from bone marrow. Source doesn't matter as long as you are extracting MSCs, mesenchymal stem cell, because it has to meet certain criteria. If for sun to be sun, right, it has to meet certain criteria, certain temperature, certain shapes, all that. The cell has to meet that criteria. If it doesn't meet that criteria, it's not the MSC, right? As long as I can extract the best quality of MSCs, source doesn't matter. So there are a lot of gimmick going on in America, like, oh, young cell from cord blood and all that. It is all gimmick. It means it is just those people who are selling, try to get money out of you rather than understanding the cell. People like us who spend years and years and millions of dollars in research. We know the science, okay? Not some salesperson talking to you on the phone like, oh, I'll give you young cells, baby cells. Come on.
It has a good ring to it. So,
yeah.
Devin, as we wrap up our conversation, let's talk about, affordability. So what is the one barrier that you see to people actually pursuing stem cell infusion or stem cell treatment? Because again, talking about the payer system in the United States, we have insurance companies that we pay premium to monthly, and then you have providers who are treating patients with out-of-pocket. So are you seeing that is a barrier to affordability or people being able to pay for services for organizations such as yourself to help people attain a quality of life?
Stem cell is slowly coming under certain insurance companies that they are covering, and it's not a lot, $5,000, $10,000, $15,000. Okay. And slowly, like Florida, Utah, they're moving forward for autologous stem cell transplant. Doesn't require a lot of big clinical trials, but there's enough data, scientific data from around the globe that it is safe and it can be used. So system is moving forward towards getting it covered under insurances so that people can get an access to it. And insurance companies are coming to the realization that, hey, if I have a diabetic patient, okay, and life cycle of that diabetic patient is, let's say, 40 years. In that 40 years, that person's going to take metformin, but because of that person's going to have a heart problem, so a heart transplant, that's going to cost money. Then have a kidney problem, kidney transplant, that's going to cost money. And vision issue, that's going to cost money. So if you look at the life cycle of, and I'm talking about insurance companies, not me. So I have conversation in the past with insurance companies, like in that life cycle of that patient, if you treat that patient with stem cell at an early stage, for let's say 5, 10, 20, 30,000, even $50,000. Okay, let's throw money at them.
Right.
And if you don't do that in 40 years, you may end up paying $1 million+ for that patient.
Yeah.
So what make more sense? 5, 10, 20, $50,000 in advance, or putting $1 million over a period of 40 years of that patient life. So I had a lot of conversations, not a lot. I have several conversations like that with the insurance companies, and slowly they're coming to that understanding. And you have to speak their language, okay? You don't speak to them about saving lives and people have a better life. They don't care, okay? They want profits, okay? Right. So you show them a profit.
Cost
instead of spending profits, not cost saving, profits. So you say, okay, instead of spending $1 million, if you're going to spend only $50,000, you have a $950,000 savings. Now they're listening. Yeah. Okay. So to speak their language to them, they're not there. They have no interest in your health. Okay. They have interest in your premium. I'm very vocal on that. Yeah. I'm not holding back on those. That's how it is. That's what it is. And you just speak their language and it makes sense to them. And I think now they're getting on board. Yeah. So pretty soon, we will see slowly, many big insurance will start covering this for their patients.
So Devin, what's your hope for the American healthcare system? America just celebrated 250 years of independence.
I have to find my book.
So I had to bring that up because Devin wrote a book. So what is your hope for the American healthcare system after 250 years of many things? And, we're still discovering and deciding how we were going to approach healthcare in America after 250 years. What is your hope? And talk about your book, please.
Here's the hope in this book. It's called Declaration of American Experiment 2.0, and it was specifically launched on 250th birthday of American freedom on July 4th, 2026. And this book looks back to 250 years, what we did from 1776 to 2026 in 250 years, and how we achieve our liberties and freedom, and where we fall and where we did not meet our promise. And then this book also talks about what we do in next 250 years. So this is the roadmap to truly achieve the potential and most highest freedom of human being that is promised in original Declaration of Independence document created by the founders of the country, America. We call it America today. So this book is not just the book. It is a civilizational book where every generation for next 250 years must read, because it's talk about freedom from invisible crowns. 250 years ago, we had a visible crown, which is a king or queen. Now the current or future crowns are invisible. Algorithms, debt dependency, drug dependency, loneliness, mining of your attention, all that you don't even know you are being directed in the direction that you thought it's yours, but it's never yours, that you've been planned or directed into that. So this book talks about total freedom. And the promise of this book is, I'm going to read you, that human being is sacred and we need a total freedom of health, mind, and spirit. That's what this book is talk about. So it should be taught in every high school, every college, goes to every policymakers, because this book talks about having the hope and in the highest promise of freedom that was declared in the independence document. So that's why it's called Declaration of American Experiment 2.0. So from today on, from this year onward, this is American Experiment 2.0. We finished 250-year run. That was Experiment 1. This is 2.0.
So where can we find a copy of that book? Where can anybody grab a copy should they want to?
Yes, on Amazon, you can find the copy, and I request your readers to have this book for them, for their children, for their family members, because this book is not some complex political commentary. Rather, it's very simply written concepts. And I'll read a very simple thing. Just the back cover of the book, it says, "The call to renew freedom, dignity, truth, health, and human purpose in the age of manipulation, technological power, and spiritual drift. This book invites readers to build civilization worthy of the human being." It is that what this book is all about. It is uniting every soul, not just in America, but around the globe, and become a guiding light for entire humanity, not just for America. That how we trade forward and reach our maximum human potential and maximum human freedom.
Yeah, I love it. I love it. I feel a shift, and a good shift. And the more people are aware and talk about the awareness, the better we can all collectively come together to make a meaningful change. Because it takes all of us. It takes all
Yes.
of us. It really does. So, Devin, I'm very greedy. And, I know you have talked about quite a few things, but I always ask my guests to leave a golden nugget or a few golden nuggets. We'll take a bag if you have to offer a bag of golden nuggets. What would you like our listeners to walk away from after this conversation you and I just had?
I'm going to go even deeper. Find gratitude in everything you do, all good, bad, and ugly. The deeper the gratitude, the higher the power of your manifestation of all your desire and all your dreams. So as long as you live the gratitude-filled life, you will see miracles happening around you, because what you're doing by living in the deepest gratitude, you're raising your energy and your aura and your power of manifestation thousandfold, millionfold. And you can make anything and everything possible. Very simple. Live in gratitude.
I love it. Thank you so much. Be thankful, be grateful. It is a miracle to see every day. It's that simple. It's that easy. You don't need that $1 million lottery win to be grateful. Every day is a blessing. Every encounter is a blessing. Every conversation is a blessing. And every interaction is a blessing. Whether it's you smelling a flower, a bee flying by you, a butterfly landing on you, that is a blessing. Be grateful. Gratitude has brought me a long way. And humility in that gratitude as well has brought me a long way. And I thank you so much, Devin, for being here. Thank you for a great, great, great conversation. I am very grateful that you made time to be here.
Thank you. Thank you. And you're a wonderful soul. You're a wonderful mother, and you're an amazing host, and you bring the best out of me by asking very important questions. So all the credit goes to Idongesit.
Thank you so much. Again, very grateful for your presence and for your time. And thank you. I'm grateful for all of you for listening to this conversation. Please share this conversation. You never know whose life you can affect. Devin Patel is doing great things. And again, the organization, in case you don't remember, don't worry, we'll put it in the show note. The organization is
Jivasa Institute of Longevity Research.
We'll make all of that available in the show notes. If you're curious, reach out. And if you are a policymaker, decision maker, and it is in your heart to do well by people, please, please, please reach out, collaborate. We need more decision makers, policymakers to really align with people who are shining their light and making it possible. That's globally, not just in the United States. So again, Devin, thank you so much.
All right.
Thank you, everybody. Take care of yourself.
Thank you.
Bye-bye.
Thanks for tuning in to Unshelling Medicine podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.